am. I am Nancy Herron. I work with the Children in Nature Network. I chair the grassroots leadership team. That's one half, but the other half, my day job, is really with the Texas Parks and Wildlife Department. So I am an educator and manage outdoor programs. But when we talked about, when you see someone with that kind of enthusiasm, the same with Dr. Suk, said we need to be at the table, and look where I was sitting. I was sitting at the table with the physicians. And that's what it's a marvelous time. It's a marvelous time. We are seeing differences. I have a PowerPoint. I wonder if you want to switch it over. Is Derek, Derek's out of the room. Somebody want to switch over to PowerPoint? Okay, thanks. But this is no problem because the first couple of slides really he covered so well anyway. And that's basically, we looked at what our picture of childhood is, was the kids running and, maybe what we thought our childhood was like. And we know that's changed. It's changed dramatically. And when we look at what that means in terms of children and their psyche, their stress level, their emotional connection with the world. And we're looking at kids whose problems seem so big to them, whose escape is through those virtual worlds.
Is that right?
That's the one, thank you. So that's our picture of childhood, and as we know, sadly, this is closer to what we know it is. 7.5 hours doing this, maybe if we're lucky 6 or 7 minutes a day doing the other. So we have a tremendous increase, not only in obesity and healthcare problems, but stress and depression in our children. But we do also know that those, just as Dr. Sanchez so well illustrated, the importance and the benefits of being outdoors in nature. And I'm so glad Ruth mentioned the executive functioning, so true. And in terms of being a good workforce and relevance not only to your child's success and the parents that you'll be talking to and all those other caregivers, but poverty issues. And again, Dr. Sanchez mentioned that as well. What was interesting is that we in Texas had approached Vista, AmeriCorps Vista, about having some folks around the state, or actually we're asking for 2 or 3, to help us start these Children in Nature efforts. Now Vista is dedicated to poverty issues. And they said they saw the connection. They saw the connection so well that people who feel well-being, emotionally, physically, mentally, all these pieces, that is part of that war on poverty that started the VISTA program. And they said, why 3? Why not 20? Why not 25? Why don't we make this a national program? We'll see what happens, but we're right now kind of vying up for having vistas across the state, starting grassroots, local grassroots efforts in Children in Nature. But what we're really going to talk about is engaging the healthcare community. The Children in Nature Network has been working on engaging the community both in the preventative and using the preventative and holistic pieces in that, and certainly we saw a lot of that in Last Child in the Woods, looking at that broader piece. The network, first off, did some research compilations, and I was one of those folks that said, hey look, nice book, but before I go forward, I want to see what you were basing your conclusions on. And I actually, for my budget out of Parks and Wildlife, paid for a couple of these compilations, and I wanted to see the research, and I wanted to know what was behind it. They've now gone on and done 4 volumes of that. They have compilations, we have compilations on health benefits and education benefits, and basically concluding that we can look at the message of healthier, happier, and smarter kids. With that, however, and all this research, and we worry, can we make the point? Can we make a difference with the research that's there? Because it's a fairly new body of evidence. And there are gaps. We don't have a lot of longitudinal studies, but I think one of the most telling pieces was one of the early allies, like Dr. Suk. This is Dr. Howard Frumkin, and his conclusion, we know enough to act. There's enough evidence, it does no harm, it moves forward. And so what we found is that we had more allies than we anticipated even early on. So there was a lot of focus in the Children in Nature Network with the grassroots leadership. And in 2006, it started with about 6 campaigns, and really thinking that nature and connection to nature starts locally. It has to happen nearby. It has to engage communities, and those communities grow through these grassroots leadership efforts. Well, it started with maybe 6 campaigns in 2006. Today there's over 85 campaigns. It's in over 40 states, multiple countries, and so you see it in Australia. You see Canada has been an early leader. That may be a little bit of a bad slide. Canada was an early leader. Japan, the Netherlands put a lot of stuff out. But what's interesting is that it didn't surprise me when Japan was stepping up. It surprised me when Africa started stepping up. We're concerned about our kids not being connected to nature. Really, in African countries, but we're seeing it in urban areas, rural areas, all over. And the network itself, its strength is through all these regional campaigns. So let's talk a little bit about what's happening in terms of connecting with the medical community. In Michigan, how many of you are familiar with the work that had went on in Michigan, the pilot? Anybody there? Okay. So there was a grant from the Kellogg Foundation to the Children in Nature Network working with physicians in Michigan. What they did is developed a campaign and a change of practice within their offices. So some offices transformed, and in, for example, the lead office there, they've got part of it, the office, in the waiting room, is dedicated to reading skills, and the other part is dedicated to nature and getting out in nature. There are posters down the hallway about the importance of being outdoors and health and fitness and looking at kids running and playing, modeling all those. They have prescription pad forms. They include in their health and wellness counseling the importance of being outdoors. In Texas, we have on our commission, on our state parks boards, we have physicians there. Our commission is our governing body. I was working with the Children in Nature initiative in Texas at the national level, and I got a phone call from a pediatrician who said, I need places to refer my clients to. I have so much problem with obesity in families and in children. Where can I send them? And what will they do when they get there? That was on me to help partner with her and provide those kinds of resources that she's willing to give out. But they need to know, they meaning the medical community, is where can we go, what can we do, what can we send with some confidence, where can we send our patients? We developed green ribbon schools, and that's what Dr. Sanchez flashed us a little slide up there. But that's just like blue ribbon schools, where it will reinforce and recognize schools that are doing outstanding things. Well, green ribbon schools also includes the health component, and integrating nature is throughout the whole thing. We launched this in, I think, May of this last year. We have 185 schools at Sunday. In this economy, 185 schools said, yeah, we're going to do something in nature and health and outdoor skills. You don't expect that, but the timing is right, as I guess I can say. Ohio, in other states, are doing something called Walk with the Dog. I don't know if anybody has heard about that. But again, these are more informal gatherings and integrating health and walk with the dog outdoors. So the value of these local collaborations are things that I hope that you will take into mind as you look at how your field staff make this happen. And there's a community action guide that the Children in Nature Network put together. We have the Children in Nature Network Connect. It's a social media tool for them to share ideas and to keep moving forward, and that's part of that care and feeding as well as an annual gathering. So we can talk together well, and we have a lot of enthusiasm within our ranks, but the question is, are we reaching our target audience? And the Children in Nature Network did a study, and it was on people's beliefs associated with children's nature experiences. This was done in a large national survey, urban, rural, different parts of the country, and there's kind of good news and bad news. There wasn't a lot of question about physical benefits being outside. Now I have to tell you, in truth in here is that when our state coalition physicians got together and they said, well, nature equals fitness, no, that didn't actually work. Because you can be sitting in an RV in your lawn chair eating potato chips, and that's not contributing to a healthy lifestyle, even though you're out in nature. But physical activity, that was not a question. And so most people did believe that being outdoors, playing in nature, contributed to physical health, but did not recognize the cognitive or emotional benefits, area that we can work on. Tremendous concern about safety in wild places, especially when you have hills and water. And they're very concerned about their children are going to be spirited away or fall off a cliff. Another thing that was kind of sobering was that their perception of nature. We talk about how important it is to have nature be a part of your world and your children's world, and they didn't recognize nature around them. There was no nearby nature. Nature was at least 30 minutes away for most everyone. There's very little modeling or mentoring or storytelling within these families. They don't recognize the importance of that. And if you think about best practices in RBFF and how to grow stewardship, how to increase people's participation in the outdoors, a lot of that is not only experiences but also a culture that talks about it. It's okay to talk about it at Thanksgiving dinner about what you just went to do or went to see or you went fishing and blah, 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 But if nobody wants to talk about it, it's not something that sticks. And what we're finding as well is that those who were young, the younger parents, had less belief in this, and the less they had experience outdoors, of course, the less that they had this support for this. So, now, back to what we're looking at as to who we believe. As we just heard, doctors and nurses are believed, park rangers, very trusted. But in terms of our medical community, the American Academy of Pediatrics has been coming out with policies that are very conducive to our movement. Things like having at least 60 minutes of unstructured play a day, and where better to do that but outdoors. They also came out with a policy on the importance in built environments of including natural spaces and green spaces. You can build on these policy initiatives and these policy statements with the American Academy. Let me add, I'll come back to that. Okay, the parent campaign that the Children Nature Network is doing is building on that healthier, happier, smarter message, and Nature Rocks. Your events need to be on Nature Rocks. Where to go, what to do. Part of this campaign. Let's move also with Kaboom has a great thing. We need to be pervasive in our outdoor offerings. But that includes that health message in every turn. We have the Nature Clubs for Family Toolkit, which we'll be using with the Walk with the Dog. When you're saying, how can I just make this simple and easy? Because that has been one of the tenets throughout, is keeping things simple and easy.